Okay, I think we've got the people and the tech reconvene. And so we're going to go ahead and start the readout. So what we have left on the agenda are the 3 readouts from the 3 groups. And then we have informal feedback and signing up for next steps. And so we're going to go ahead now. For those of you who are still in the process group, please come over so you can hear the readout. Tamara, let's do it. Winning the prize for most colorful, right? Here we go.
Process team, we're really hoping you're going to hear what the patients want to say. Thanks, Matt. Okay. So this one was easy. We just decided to just blow it all away and make one thing. It was kind of cool. No one's taking me seriously about this, but it's true. That's what the people team came up with. There were some big core themes to what the people group focused on in our discussion, but really anchored, surprisingly, around where you see the stars showing up, which was the beginning and the end. So what was really beautiful about the conversation around episodes and bundles was that what we realized is that the existing experience is fraught with a lot of these self-start points that the patients have to undertake by themselves and that they find incredibly confusing, and that oftentimes they just give up because they feel overwhelmed or stressed out. And that really what patients were looking for is a lot more information, a lot more guidance from clear and trusted sources up front so that they could make clear choices that allow them to get well at the end in a way that's sort of predictable. So the specifics were they want to see a single trusted navigator that's from a neutral third party. Not a payer that they're still paranoid about, giving their information to, that for some reason they still think might cause them to log some pre-existing condition that would deny them benefits, which is unfortunate, but that was what the patients seem to want. Not from an employer that they're fearful they might lose their job from. So the idea of data privacy in the sense that I can go and do my research somewhere where in a source that it doesn't have any bias was really important. Now, I think we could probably work to build that trust with the brands we already have, but the idea here was that there's some kind of navigator, it's some tool and technology where I can do my research about my condition, do my research about my symptoms, do my research about providers, do research about prices, and make a bunch of choices that are gonna move me downstream. The next big theme was people wanted a single person to be the person that they're dealing with when they're buying care. And I think there was someone who is going to tell a little story about the contractor. I don't know where he is. Oh, there he is. Wonderful. So, Steve, if you could give the metaphor.
Steve Cook. So the metaphor I threw out sort of at the end, we didn't get to flesh it out very, very far, is with a general contractor. So if you've ever been in the position where your roof started leaking and you had an urgent need for a care encounter for your home, or if you just simply wanted something elective like an addition, you probably, hopefully, didn't go out and look for a carpenter, look for a painter, look for an electrician, look for a plumber, look for all those things. You needed all of those people, but you engaged with a general contractor who knew all those people, probably knew multiple electricians, multiple plumbers, and could help you, A, assess your situation, assess your finances, figure out what the right path forward with you was. And you interacted and had choices all the way along the way, but you had that trusted advisor who helped you set your expectations for the entire encounter and helped you navigate all the way through. So we wished we had 5 more minutes to talk through that sort of analogy.
But it's a good start as our vision for the future. Part of that meant that really we bundle everything. Everything is a bundle. There's a one-stop shop where I either choose one thing, or there were two things, I think. I come and I look to buy a diagnosis, and then after I get my diagnosis, I can come and I can buy a treatment plan, and that carries me from start to finish, where all of my care gets coordinated. And the price is up front, it's transparent, it's clear, it's guaranteed, there's a warranty around it, so that when I make it all the way to the end, I get one bill from one place that isn't confusing, and I can trust it, and I know that I can pay it. It's not an EOB that's a bill but not a bill. It's not coming from it's not coming from 5 different providers. They're not showing up 3 months after the last bill came, where I don't even know if I ought to pay it or not. So one bill from one place. Along the way, there was a real desire to make this whole experience from the end of the arrow to the other, the end of the arrow patient-centered. So one participant sort of described the experience of, as I make my way through all these different facilities and providers, I have to bend myself to their way of doing things, their way of intaking me, their way of navigating and wayfinding inside their building, their way of communicating with me. And patients really want that flipped. They should have a consistent experience all along the way. I shouldn't have to have 7 different email or text or messaging communication tools to communicate with the different people in my care team. I shouldn't have 18 different ways to schedule those appointments. There should be one single place for that. Are you guys doing okay holding that up? Sorry. And then, you know, some of smaller topics along the way that were really important in terms of this future vision that sort of underpin a lot of these things. The concept of shared decision making, the concept of convenient care that includes technologies like telemedicine, nurse hotlines, you know, after hours care, that sort of thing. The idea of, what do you say, a unified EHR, so that all the people in my care team actually have access to all of my records, and I'm not the person responsible for carrying my MRIs around when I walk from place to place, and that the whole thing should be seamless and feel good at the end, and that I should actually feel like I got what I paid for, and that what I was asked to pay wasn't terribly surprising. So that was what we all wish will happen.
Thank you. Let's have Process go next.
So it's a hard act to follow, but we sort of bucketed our thoughts into these 4 areas. So you can see them on this slide up here, which I'm very amazed that you guys made this so quickly from all this synthesizing all this information. Consultants. Yeah, good job. So it was really about defining roles and responsibilities, so for all the different stakeholders, our patient, provider, payer, defining the bundle, what is included, or the episode of care, defining what's included, what are the costs, really focusing on the patient as the center of that. We tried to keep that message really close to heart. There, we talked about simple, clear metrics and not 200 of them. That's often a problem to try to get that down to 4 or 5 or 50 that really work for the bundle. Defining, so I should have just gone through the title and then the opportunities and concerns first, but I apologize for that. Defining options and then creating feedback loops so we can make sure that we're getting clear information of what works and what doesn't. And so under those, we talked about opportunities and concerns, and you can see the blue and the red here, a little bit more of red concern areas in all of our little buckets. So under defining roles, our opportunities are really to align tools and technologies for common collaboration and clearly outlining roles and responsibilities. But folks really had concerns about patient willingness to be engaged and really where that patient belongs in this pathway. Difficulty deciding who's the payer. So is that the employer? Is that the health plan? What that relationship is like, and no clear end-to-end framework. So under defining our bundle, our opportunities again, are also defining it as a patient journey, keeping the patient center, the metrics piece, and aligned objectives for all stakeholders. Concerns are really around no clear standardization and adoption scalability. So some pilots really work and work well for some clinics, but how are we going to grow those? Under defining options, so defining criteria for specific options, ability to create unique differentiated options that benefit patients. And folks are concerned about patient decision making and too many options. I think that's a huge piece. And we also talked a lot about shared decision making here and what the state is doing to certify patient decision aids. We have a lot of optimism about that. And then under creating feedback loops, so we can really see what works and what doesn't. Data transparency and then communication between payers and providers are really where our opportunities lie there. And then folks are concerned about having too many variables and integration of different types of technology tools. Other comments, ideas? Oh, and we have some next steps here, hidden on the slide. So it's really continuing to refine the bundles and warranties, discussing lessons learned from our current programs and getting a broader perspective, so making sure that we're hearing what does and doesn't work, especially from our collaborative recommendations and the community. Working with local payers to collectively define bundles of care, making sure everybody is at the table, including patients, so they can talk about what that experience is like for them and where our areas for improvement are. Discussing methodologies to lead with the business case to really get more buy-in, and finding ways to collectively get these bundles into provider networks and really start operating them, really starting to get them into the pathways to implement them. Okay. Other comments? No, right.
Technology. We didn't bring our poster up because it's not as pretty, and also because we're technology. I'm going to just read the few so whats off of my iPhone. But honestly, I think what's interesting about technology is, by and large, technology needs to follow people and process, and we don't have a lack of great technology or technologists. It's actually about how you bring it together within the process and regulatory framework to support consumers. And so a lot of what we talked about, what is really broken, I mean, the big thing that's not working is interoperability. And so the fact that you can't get data together in one place, and in particular for consumers, that means that consumers don't actually have control of their data and the many different sets of clinical and claims-based data that would help guide them in an episode of care. And in terms of actual solutions to that, I mean, a lot of it will be ultimately driven by process as well. We talked a lot about the fragmentation also, and so again, there's not a lack of great technology solutions. There's just a lot of them, and so if you look at the consumer journey and you break it down to the 15 or so different segments for a procedure like we did across the long sheets of paper, you just about have a different technology solution in every single one of those stops along the way. And in most cases, there's not a clear handoff. And so nobody wants to be flipping from app to app to app to app to get, that is not a seamless experience. And so over time, the rationalization of that is a big barrier to providing kind of integrated care. In the context of bundles, we talked about what's really missing in terms of solutions and tools that exist today. A lot of it is really on the front end. And so obviously the referral process today, in most cases, is, essentially patients go to where their specialist tells them, and even if the patient is doing research on their own, they're coming in with a preconceived notion, and there's not a lot that's done, and even has been discussed in the context of bundles in terms of off-ramps. So if a patient actually thinks they need a hip replacement, that the right education and information is being provided, that may not be the best option. Also, conservative care being provided leading up to a surgical procedure. And so how can you use telehealth and other technology tools to make sure that on the front end that a patient's being guided into a bundle and the right type of bundle effectively, and on the back end, obviously the ability to actually activate patients in selecting in. And so we talked a bit about scheduling and also just simply how do you activate patients in a way that they aren't being today, which again goes back to people and process, to understand the data on quality, cost, and appropriateness, and bring it all together in a simple and seamless way as well. Chris, any additional kind of points?
Only the concept that the technology is only as good as the people using it, and that in a lot of this redirecting patients and appropriateness and everything, there's lots of opportunities to communicate via technology and build things, but you know, the doctors, the staff, all those people need to understand what it's doing, why it's doing it, and offering it up, and it very in a very old school, typical manner.
And then one other point that kind of beyond the bundle itself that we talked about is the fact that for this state, as this initiative moves forward, there's a really great need for hopefully a lot of experiments to be happening statewide, and as part of that, better recording and reporting of data. So how do we actually track amongst payers, providers, and especially consumers, how they're experiencing the quality, value, and other important factors of various bundled payment flavors, and that we're actually taking a really iterative and evolutionary approach to implementing programs statewide. And so identifying ways to consistently track and record that and then publish it and provide transparency so that it can become a continual improvement process for the many different stakeholders involved is something that is lacking today that would be incredibly powerful in moving this forward faster.
Awesome. Thank you, Matt. Thank you, Chris.